Hello, good afternoon, everyone. I'm Krista Droback with Aligning for Health. Forgive us for starting a little late. We've had a few technical difficulties, which we hope will be resolved shortly. I am going to go ahead and pull up a slide deck to walk through, and then we're going to start with Dr. Ford and then have our panels. So let me share my screen. I wasn't kidding about the technical difficulties that we're having here. My apologies. Okay, let's start off with just some, we're going to have some audience participation. Let's start there. So today's webinar is really about how do we integrate food, housing, and healthcare and transportation and all the social factors that we all know about. We wouldn't be here today unless we understood that healthcare is a lot more than just clinical care. It is overall well-being, which includes housing and food and transportation, as I've mentioned before. So one of the baselines of better integration around the whole person is actually talking to colleagues in other sectors. So we have a very short audience participation today, just to find out and for us and for you to realize that sometimes we travel in our own circles and don't reach outside enough. And that actually has real consequences for policy and action. If you don't know anyone in food or housing, you're unlikely to get together and plan to do an integrated approach. So Casey, can you put up our two questions for the audience today? So the first question is, which sector do you affiliate with? We have healthcare, housing, food, transportation, other. We're hoping not too many others, but sometimes it can be hard to figure out where you are. Okay, so let's just wait for a second here. Okay, and then next question, Casey.
I think they both launched, so we should.
They both did. I mean, our technical difficulties just continue. Here we go. Okay, so we have 53% of the audience are in healthcare. Not surprising. We're called Aligning for Health, and our networks are all healthcare people. So we are so happy to see that we have people who primarily identify with housing, food, some transportation, some all of the above. One of the things that we hope will come out of today is an inspiration to go and get to know some of your colleagues from other places. I think sometimes we think of integration across these programs is kind of like boiling the ocean. How am I going to address all the issues that I'm seeing with someone who is coming into my clinic or to my nonprofit or to my housing office that have food insecurity and housing insecurity and multiple chronic conditions, and it can be very overwhelming. So we hope today that at the very least, go and build some relationships with people outside of your sector, because that is really going to start the seeds of what can be done together. And maybe if we scroll down here, we can see how often do people already coordinate with other sectors. So we see often 73%. I mean, I think this is probably an audience selection issue that the people who are joining this webinar probably often coordinate. I can tell you that as a healthcare person, when we started Aligning for Health, we wanted to make sure that it wasn't just healthcare people. And it was very difficult for me personally to reach outside of my own network because I just didn't know that many people from the housing sector or the transportation sector, et cetera. So I'm glad that I don't have to tell you all to do this because it sounds like you're already doing it in large numbers. So thank you for participating in our poll here. So if I just quickly bring up the slides, I just wanted to show you two slides. Actually, can you just keep going down, Melissa? More. We've already done this part. Oh, I think these are the old slides. Okay, forget it. We'll just continue with our technical difficulties. You can just leave out of this. The two slides I wanted to show you was all the good intentions that we had in government create two different slides. That one shows how it manifests itself in the government, which is a whole bunch of lines to a whole bunch of different programs. And what I like to say is that all of our programs are built vertically, but people live horizontally. So if you think of how all of our good intentions have manifested in government, it is different agencies with different people inside the agencies with different things that they're supposed to be implementing, and they're doing their daily jobs. And then the second slide was I was going to show you an example of a woman named Jean and how this manifests in her life, and how she basically has a full-time job and trying to access the benefits that she's eligible for, and take care of her kids and look for a job and do all the things that are extremely difficult. So if you think about it both from a government perspective and from the person's perspective, it's inefficient, it doesn't work. So really what we want to talk about today is how do we better integrate, and two of the ways to do that are blending and braiding. Blending is how do we use existing authorities to weave together programs and funding streams, and then or that's braiding, and blending is how do we pool the resources together, which is obviously harder to do without a lot of new congressional authority. So we're going to hear from Dr. Sandy Ford at the White House first, and she is trying to do this every day, coordinating across agencies. We're going to hear from Sue Paulus, who is trying to work with local governments to coordinate. Coletti has a integrative service in New York that serves as a best practice for kind of how to do this, like she's living this every day. And then we're going to hear from Amy Regal on what it's like to work in homelessness and housing and still have to touch healthcare. So first thing we're going to do is hear from Sandy Ford. Can you hear us? Can we hear you? Is the bigger question. Okay, Dr. Ford. And by the way, we have a landing page on our website, Aligning for Health. It has everybody's bios in it. It has, it's going to have the recording and the slides from this event. And so I'm not going to go into great detail with everybody's bio. We have extremely impressive people here today, and I encourage you to look up their bios, but it's going to be on our page so that we don't use up a lot more time here today. So please take it away, Dr. Ford.
Great. First of all, making sure you can hear me. Yes. Okay. That's job one. All right. So thank you all. First of all, super excited to be with such a rock star panel. But I want to give you some background. Yes, my bio is ridiculously long, but I am Special Assistant to the President for Public Health and Science in the Domestic Policy Council at the White House. But for the benefits of the story I'm about to share, I'm a pediatrician. And as a pediatrician, we deal with not only the child, but really the whole family. And so as a fresh out of residency pediatrician working in a free clinic in East LA, I had a patient, a little girl, who kept coming back over and over again with the same ear infection. And we could not figure out what the problem was, because I speak Spanish, I'm bilingual. In fact, I spoke Spanish so well that my patients were complimenting me on my English. So we knew it wasn't a communication issue. Medication is free because the clinic is free. All services are free, but this child keeps coming back over and over again with this ear infection. And we're trying to figure out what's happening here. And so finally, I asked the mom, so what's going on with you? Why does this kid keep coming back? What are we missing here? After further investigation, very much in the non-clinical realm, we found out that the family was living in someone's garage. And amoxicillin, which is very inexpensive, has to be refrigerated to be effective. And so that's why this child kept coming back with the same infection. We would never have known that if we had strictly focused on the clinical piece of this, because we were doing everything that doctors should be doing in terms of medical interventions. But number one, we weren't asking the right questions. But more importantly, okay, so now I know, but there's nothing I can do about it, you know? And so that really, in a nutshell, when people ask me what are the social determinants of health, that is the quintessential real life example of how you can do everything that you think needs to be done and still not even be close to solving the problem. And so what we are trying to do at the White House is address this at the federal level. Very excited about this work because this is the first time that the White House has tackled this beast across agencies. And we like to use the term whole of government approach quite often, but this really is a whole of government approach because it's so far beyond the clinical medical realm because it's the information, the gathering of the data, because you have to know what you're trying to solve. So there's the privacy pieces, the data collection, the data sharing, because I, in my pediatric office, may know that this person is unhoused. How do I get that information to the person that can do something about it? So it's the data sharing, the data interoperability, without, by the way, having to have this poor mom go to 5 different offices to get this application filled out and verified over and over again. And we don't even want to talk about whether she's documented or not, because that's a whole nother set of drama. So how do we share information in a way that protects clients' privacy and safety, but shares it with who needs to have it? That's number one. But then back to the braiding and blending, how do you pay for it? Because, you know, the more services you do, the more it costs. And healthcare, we're still fighting this battle with federal funding. You know, Medicaid's like, that's not our job. But your job is to provide health insurance. And part of insurance is safety and security. And so we're trying to help understand the ROI on this. You know, it's public health is really tough in general because the things that we do don't impact for so long that it's really hard to convince legislators to do things when they have such a quick turnaround cycle. And the investments that you put into these kinds of interventions, they take a long time to manifest, but they're very powerful when they work. So what we're trying to do right now, we've gathered a great array of agencies on a weekly basis. We've had, I think last week was our 25th meeting to talk about what are we going to do? How are we going to address this? And so I will tell you that when I first started thinking about social determinants, the 2 big things that popped up in my head were housing and food insecurity, because those are the 2 things that loom over us the most. But there are so many other things that confound one's ability to access healthcare. And we saw that certainly during the pandemic, transportation issues. We think that we always pat ourselves on the back because we think we're doing great stuff. And I will say that telehealth is a wonderful tool, but everybody doesn't have data connectivity and everybody is not technically savvy enough to manage telehealth. And so, data connectivity is a social determinant. Transportation, education. Again, doctors listen for keywords. And this is what I tell people when they go to the ER, like, you got to say the right thing to make them take you in. And that's awful that you have to do. And I will tell you, even as a parent, I have had to throw those medical terms out there to get my child seen, because otherwise you're just another kid with a stomachache. And so, health literacy is a social determinant. Literacy in general is a social determinant. Economics, where do you work? Do you work? How much do you make? Do you work hourly? Do you have time to go see a doc between 2 and 2:30 every day, for your child? So we were trying to figure out how to address across the board, because it became so much bigger than just housing and food insecurity. And so we've pulled in multiple agencies across the federal government to identify policy levers and other partnership opportunities, because policies sometimes take a while. And so what are some other things we can do while we're waiting for legislation to get through? And so from the 50-foot level, there were 3 things that we wanted to address. And so we call them the pillars. The first is what I call a backbone organization. Some call it a bridge organization, a convening hub there has to be some neutral party, more or less, who manages the funding, manages the reporting, which we all know when grants are involved can be quite cumbersome and complicated. So somebody who manages all those reports, who deals with the data linkages, the data connectivity, whatever privacy concerns. So there has to be some sort of large convening body that is almost like the hub in the center of a wheel that deals with the other spokes. What we want to do with this social determinants of health action plan that we are developing is to figure out how to efficiently connect the hospital system, public health, and social services in a seamless way so that we don't have to send a patient, a person, an individual to 8 different agencies. We know that if you are unhoused, it is highly likely that you are also food insecure. So why would you have to go to 2 different agencies to get services that we already know you need? So we're trying to figure out how to create sort of a one-stop shop process that you go to one agency that has your information, and that information can be shared with all of these other services that you might be eligible for or require. So to do that, you've got to have that backbone organization that is the collector of the information, that is the sharer of the information, but you also have to have data interoperability. You have to have your privacy concerns addressed. And so we are working to try to have, and you have to have uniform systems of collection. All of these different agencies have different platforms, and everybody is so wed to their platform. Their platform is the best platform. What I learned, my favorite example was when we were, when I was doing state public health in Georgia, and one day the person in charge was like, okay, everybody's going to have the same system. We're all going to have the same IT system. And I was like, that's the most ridiculous thing I've ever heard, because the IT system is like an Android phone. Everybody's charger works on that thing. You know, you don't have to have a Samsung charger, you have to have an Android charger. So what we're trying to figure out for data interoperability is, what is a baseline platform of data that works, that we can just share, that you don't have to pay hundreds of thousands of dollars for, number one, that provides information between the hospital system, public health, and social services, that addresses privacy concerns. And we've seen these systems at the local level. There are places that are doing this in an extraordinary way. And so rather than reinvent the wheel, we've been talking to stakeholders to learn, how are you pulling this together, and then figure out how we can replicate that on a federal level. What kind of, fair cost platform or no cost platform that has the interoperability we're looking for and can connect these different services. So that's your backbone organization and your data. And then the blending and braiding is critical. What I have learned from my time in public health is that grants are extraordinarily helpful in terms of supporting initiatives, but can also be very restrictive. We have grants that require community engagement as part of the funding, but you can't feed the people that come, which to me is ridiculous, because once you start bringing in, and to have appropriate community engagement, you are most likely going to be meeting in the evening or on the weekend. So don't call me to a meeting at 6 o'clock and not give me something to eat, or don't call me to a meeting and I have to bring my children. So I don't have snacks for my kids, I don't have childcare for my kids, and now you're going to sit and talk to me for an hour and a half, and I'm going to fill out a survey or whatever. I mean, so we have to have more flexibility in terms of what we can do with the money, especially as it relates to community. We take advantage, I think, a lot of community and have them do a lot of surveys and things along that time. Those are things that should be compensated. And can we put that in a grant that we can pay for that? Can we put in a grant that we can encourage more collaboration, that you must work with community as part of the requirements for your funding? So these kinds of things. And when you do that, there has to be flexibility in how you spend the money. So can we loosen up some of these restrictions with grants and be able to make decisions based on our local needs of how money is spent, which is a real challenge, because it's so much easier at the federal level to just say, these are the things, and this is what we're going to spend the money on. So we have these 3 pillars: data, funding, and backbone organizations that are going to be the baseline of the social determinants of health White House Action Plan. And then we've gotten feedback from the different agencies on recommendations for addressing those three pillars. So we are in the process. We got submissions a couple of weeks ago, and I've just been going through them. And we have a good, 4 or 5 hardcore solutions that we think will address some of these things. Not perfect, not the magic wand, but certainly will move us to a different space than we are right now. So very excited about this work. Have been super appreciative of actually most of this panel I have interacted with in relation to this work. And so I'm very appreciative of their input. This is community level, and y'all know what you need. And it's my job just to figure out how to get it to you. So with that, I will stop, and we can take the rest of the time to answer some questions.
Dr. Ford, I'm just going to ask you one question before we go to the panel, and then we'll take more questions in the chat. How can stakeholders be supported by what you're doing at the White House and learn from what you're doing? I know that you're going to put out an action plan. Are there action items for stakeholders to take to try to benefit from all the things that you're doing and learning in what you're doing right now?
That's a great question. And just so you know, I don't have access to chat, so I'm not going to be able to see what you all are chatting on. So someone will.
Oh, okay. I'll make sure that I'll ask the questions out loud.
Okay. All right. Great. I think, the stakeholders have been very, very helpful to us in sharing best practices. Honestly, like I said, we're not inventing anything here. We've talked to state level, local level, community level folks who have done amazing interventions that did exactly what we're trying to do here, just on a smaller scale. And so I'm always interested in hearing more, especially about data integration, which seems to be the biggest challenge. How are you able to share data across platforms, across agencies? What are you using? What is it costing you? I think what we have heard from the stakeholders that they were looking for is guidance. I think a lot of these programs are put together with fingers crossed that you're not doing anything illegal or, and it would be really nice if we had a federal document that says, this is okay to do. It is okay to spend money across programs like this. Here's where it says that it is okay to share data like this. So those are the kinds of things we're working on. And I think from my perspective, it would be helpful to know what those questions are. Is it okay to X? Is Y allowed? And then we could make sure that specific question is included in the document.
Maybe we could help with that. If folks on this webinar have specific questions for Dr. Ford and OMB or others that you think might be hindering your program, maybe just let Aligning for Health know, and we can help be a collector of some of those questions, because I've sat in rooms, at the state level where all it took was one person in the room to say, oh no, the federal government won't allow that. And the conversation was over. So,
right. And sometimes it's not even true.
Yeah,
it's like, we've just been doing it like this, but is that really, you can or you don't,
Yeah. Well, terrific. Dr. Ford, thank you so much. We're going to turn to our panelists for a bit and come back then with questions for everybody. Erica Coletti, I'd like to start with you. You are, and the reason is also because you are working with data and you are connecting people, through technology. So can you tell us a little bit about Healthy Alliance and what you're doing to solve one of the biggest problems, which is connecting everyone through technology and data?
Sure. So we are an organization that has a very varied governance. So I just want to point that out too. We have health systems, community organizations, local government, and others. And I think that does play a big role. But we support community-based organizations in technology, infrastructure, business process, and in funding, sort of back office type services, as well as operating a referral network between organizations. So we support medical, behavioral, and social care providers in getting people connected. So really our customer at the end of the day is the person, the individual. So we really want to make sure that we get the individual to the supports that they need. And so how do we like help this system and get that person connected?
And Erica, you're in New York. Are you
Yes.
throughout the state?
We are in upstate New York. We cover about 25 counties, you know, going up from the northern Hudson Valley to the North Country and then over to Syracuse. But we collaborate a lot with other organizations throughout the state and the city and Long Island too.
Even just that would be hard to get everyone connected.
Yeah.
And then quickly, what is it that excites you right now and makes you feel optimistic? And then what is something that you're worried about?
Optimism. Yes, I have a lot of it actually. I am very excited. I feel like we have this great opportunity and so many terrible things happened with the pandemic. I know it's been, you know, said and continues to be said, but it really like shined a light on what is wrong and like has really galvanized, you know, here we are. And it's just, I think the language has changed, the looking at things has changed. Without it, I don't know if we would have had this opportunity to say, hey, Department of Labor, Department of Health, Department of Education, we all have to work together because it's all like part of that fabric. So that's what I'm really excited about, just the opportunity for change and that there's others that really want that too. I think what keeps me up at night is a lot of what Dr. Ford shared. You know, getting useful and actionable information to those who are working with individuals, like right there in this like trusted relationship, so they can help them more easily and without putting the burden on the person, is that there's a huge complexity around the data and all the stuff to do that. But boy, if we can make that a reality, I think we can really make some big change for our public health and the public good.
Thank you. Thanks, Erica. Amy, I would love to go to you next because you are actually in a situation where you are working with people at that moment where it would be nice to have the information. So Amy Riegel is the executive director of the Coalition for Homelessness and Housing in Ohio, formerly an Aligning for Health member. So we're happy to have an alum with us today. But can you talk about the experience of needing that information and then also what you're excited about and what worries you?
Yeah, so within the work at the coalition, we do represent the whole state of Ohio, so all 88 counties in the state. And so when we're trying to tell the story of people living in the state of Ohio, that is people who are in extremely rural settings, urban settings, and everything in between. And we're talking about a lot of different stakeholders. And so in that, we often need to be able to track data, be able to communicate data, and people come to us and say, what is the real-time situation that's going on with homelessness or with evictions or with this? And what's the difference between Columbus, Ohio and Portsmouth, Ohio? And how can we very quickly in 5 sentences tell this story? And without extreme amounts of data, oftentimes we are giving information that we know is wrong. We know that it's not capturing the full picture. We know that it's not the real-time data, that the lags are creating problems. And so it really can make policy makers think one thing when the reality on the ground we know is something different. And trying to figure out how to close those gaps is really important and would, I think, help us to make better policy decisions in the long run. So when I think about what I'm excited about, I think one of the opportunities that is there right now is that so many people are interested, especially in my world, in housing. And so we have businesses coming to us. We have chambers of commerce. We have health. We have the mental health system, the disability system. We have at all the different agencies at the state level, but then a lot of private sector groups coming to us and saying, we acknowledge that housing is a problem. We acknowledge that there's a housing crisis going on right now. How can we be a part of the solution? And that's a really exciting place to be. But we also know that part of the reason that they are coming to us is because the decision makers in these fields and in these industries are, mid 50s to 60-year-old individuals whose kids are trying to buy a house right now, and their kid can't buy a house, right? They're personally feeling the burden of what's going on in the housing market, and they figure other people must be feeling it also. What concerns me is that we have this opportunity right now with people being interested and engaged with funding through some of the federal relief funds that came through COVID-19, and then also some appetite for policy changes. But what I know from my experience in working through the housing crisis in 2008 and 2009 is once the upper income and middle income individuals stop feeling the pressure, all of the interest goes away. And if we can't tell the full picture story of how it's still impacting the most vulnerable parts of our community, very little progress can be made going further. People think, oh, it worked because I'm in a better position, but they don't realize that the vulnerable populations of our community are still suffering. And in many cases, the system created another ceiling that they can't get past. And so that is, I think, the opportunity with data that we can tell a better picture moving forward.
Yeah, because one family might just have a housing problem where another family has a housing, food, transportation, employment, education, et cetera, problem. And if you only address one of them, it's hard to move forward. So,
Absolutely.
Sue Paulus. Sue is the Director of Health and Wellness at the National League of Cities. Would love to also hear what you're excited about and what you're worried about, but I sort of imagine you helping your members trying to do what Dr. Ford is doing at the city level. How do you get all these departments to work together and talk to each other and better blend and grade services? So would love to hear about how you're working with your members, and then what you're optimistic and worried about.
Yeah, no, thanks, Krista. And it's so great to be part of the discussion today and be with this esteemed panel. Simply stated, our health portfolio is rooted in a key principle, right? Where you live shouldn't determine how well and how long you live. And so our work takes shape through what we call our Cities of Opportunity initiative that we started in 2018. And it was really built with the idea that to truly transform and revitalize communities and cities, right, where we have these concentrated disparities, cities would need a different set of tools and the ability, right, you just said it, Krista, to set the table, right, to work in alignment across city agencies and multi-sector stakeholders. And so the Cities of Opportunity initiative at its heart is really to help strengthen city capacity to more effectively use data, leverage assets, including resident engagement, right, to develop more comprehensive approaches. And so whether it's housing, education, community revitalization, substance use disorders, economic opportunity, there are these common barriers, right? So I think what you asked, what's keeping me up at night, what it really takes, a lack of recognition is about what it really takes to better catalyze funding that can provide these wraparound systems and supports for vulnerable individuals and communities, right? The capacity to use data, the capacity to braid and blend funding streams, the capacity to map and connect, right, across systems and assets toward a greater shared aim. So on the hopeful side, what we really see in our work with cities are that there are opportunities to move from these one-off silos, right? The federal grants that trickle down, are oftentimes the largest, a significant, they're usually quite large, right? And so if they can be seen as catalysts toward greater transformation, that would be a different way than how we think about them now, right? And so federal grants are a part of it. But for philanthropic and private funders, consider how their support could better align and leverage the overall funding landscape, right? And to support some of that administrative capacity building that is so essential, right? Including aligning across city agencies and with multi-sector partners, right? The table isn't set. And that's really what we're trying to do through the initiative.
So I want to put you on the spot. Can you give us an example of of either administrative capacity building or blending and grading that actually has worked?
Sure. So, you know, we've actually developed a series of city case studies, given the urgency around substance use, mental health, and homelessness. So I can put a link in the chat to that. But I'll use an example from Tacoma, Washington. You know, like many cities through COVID-19, Tacoma city leaders really recognized gaps as their healthcare workforce, like many, right, took significant hits. And at the same time, right, their low to no income residents were in greater need of livable wage jobs. So through the initiative, through the Cities of Opportunity initiative, we really worked with the city team to help them catalyze something that already existed, their anchor network partnership. And so they started with some questions, like what is a livable wage in Tacoma? And they now know that that's $24 an hour. And where is the projected job growth within the healthcare workforce, right? And so what our role was to support the city in the use and analysis of data that informed what they're calling their new Earn and Learn pilot. And the effort is really braiding city and county funding streams, including American Rescue Plan Act dollars across departments like housing and workforce. And so the pilot also includes direct cash stipends to program participants, because as a key barrier expressed by the community on the front end was the inability to take time off from their current places of employment, right? Low wage jobs. And so because the community was engaged in the design, the structure of the program is actually aimed at meeting the needs of the community members. And so I use this example because we were able to support the city with data analysis and accelerate their existing partnership to better pool their funding streams together around a shared vision. And so now they are looking to expand this program to other low-income communities in Tacoma.
That's terrific, Sue. I would love to make sure that the resource is available to everyone who's on today, because you know, reading one case study from a city could spark ideas in other cities and counties. So maybe we could put a link to it on our landing page that is this webinar. That would be really, really helpful. Erica, I want to ask the same kind of question to you. An example of bringing, and has there been a time when we've been able to put funding together in a way that supports the network that you have built?
Yes, I say that's what we do all the time, and we continue to learn through that process. You know, some things have worked well and some things haven't. But one example I think that did work well was really pivoting around, again, COVID, when everything was so stressed and the communities were so stressed. Like, we wanted to get dollars out to the community supports as quickly as we could, but also having some accountability with that. So we focused on the service areas, and there were broad, including housing and transportation and food, but more than that too, even like job losses and you know, social supports, other social supports and schools, around infusing dollars for data collection and referrals, and making those simple things to do so you could see what was happening, but and an incent around that, but still get those dollars out without it saying, oh, you got to apply for this big, you know, grant and do all these other things in the midst of everything. So I think that was a success at taking, you know, government disaster dollars and trying to move them quickly to support the bigger picture. I think the challenges that we've experienced, though, in the blending and braiding and seeing it among the community organizations we support, really has been a lot of the focus on the programmatic perspective, program models with certain requirements. And then there's all these little grants here and there that don't really add up to much for an organization to actually sustain a support. And so looking forward to, the opportunity to like let some of those requirements on the how somebody does something, to let innovation and creativity come into play, and with some more consistent or at least a longer runway that really like allows for success instead of kind of just focusing on programs standing up and then shutting programs down. So we're trying to play some of that role where we can, but I think there's definitely a lot more work to do.
It's terrific. Thanks, Erica.
Sure.
Amy, when you started in working in homelessness, I'm assuming you probably did not expect to have to know much about healthcare. Do you have an example of being able to leverage healthcare dollars and blend or braid any of the funding together to actually address homelessness or housing insecurity?
Yes. So one of the efforts that is continuing in the state of Ohio is a program that I actually worked on in my previous life, but Healthy Beginnings at Home, which looks at rental assistance and how it helps to improve birth outcomes. And that program had started strangely with its state funding coming through the Ohio Housing Finance Agency, which is who funds the development of housing. So it was always in a weird place, but it actually got adopted by the Ohio Department of Health. And they are the ones who are now putting the energy, the effort, and the focus behind that program and really becoming a champion for the work. And so that is very reliant upon individuals with great knowledge about housing and how housing works and what are the proper outcomes when you're studying housing, but then also what are the right healthcare from a health system perspective and a health plan perspective. And now we're also starting to look at child welfare system and other savings to different parts of the state, including addiction services and mental health. But it takes experts in each of those areas to know what it is you want to track, what you want to track, because you have to know that from the beginning and you have to build your system to move towards that. And so it's not only the funds coming into the program and blending and braiding those together, but it's also the minds that are coming into the program and the levels of expertise and how all of those are acknowledged and respected within the space to bring an effort like this together.
I want to highlight one reason that we're talking so deeply about blending and braiding is because grant funds, as we've heard today, are ephemeral. I mean, they come and go. You really can't build a sustainable long-term program with grant funding. And yet we have billions of dollars that are, in the Department of Agriculture or HHS that are fund programs on a sustainable long-term basis. So trying to bring those funds together are important. We at Aligning for Health focus a lot on how important it is to have cross-sector relationships, and those relationships tend to be at the local level and at the state level. But we have Dr. Ford here today. We are a federal group, so I want to touch on what the federal government can do from your perspective to help really catalyze more of this blending and braiding. And I think one of the things we've already talked about, Dr. Ford, is the idea of what's permissible, because obviously, again, it only takes one or two people to say, oh, I'm not sure we can do this, and then everybody stops. So that permissibility document is going to be critical. But Erica, why don't we start with you? If you could ask the federal government for something, what would it be?
We'll do a couple things. I do think, in general, understanding that this takes time and it needs continued investment to make change. So doing short, brief things, I don't think necessarily gets you there. So we have another 1115 waiver that's been submitted. New York State has to CMS, and we're hoping that gets approved again to take this to the next level. So for New York State, and to continue that and hope the process, if I were to ask, those processes don't take so long, again, in the background and the negotiations and so forth, that we continue to move those things quickly forward. And that the
So
federal,
like an expedited process for.
yes,
Yeah,
Yep,
that,
yep.
and sometimes the federal government has done like templates before. If someone's done something really innovative and done it well, there can be
Mhm.
like, you know, a template for how to get it done quickly.
And we are seeing signs that some things are like, those things are moving quickly, and just know that like our state government is looking forward to that. I think that's one thing. And then the other thing around where I think there's opportunity too is in the consent process for the individual. I mean, this goes beyond just the Medicaid or the it's like Medicare has a process, and this agency has a process, and these have a process, and there's these kinds of organizations, and it feels like there's opportunity to put the decisions in the individual's hands in some way, and it's a technical challenge that I think many have tried to solve, but in silos again. And if we could get it after that in a more global way, I think that would address some of the privacy, concerns that we may have around this, the data sharing.
So when your members are talking about things that the federal government can do, are there trends that of asks for the federal government?
Yes, I would say, first and foremost, because a lot of federal funds usually go through the state, right? There's usually some assumption that the capacity on the ground exists to get those dollars to the right places. And in small and mid-sized cities, that's sometimes not the case, right? We saw it with the eviction prevention dollars. Why'd those dollars not get used? Because it assumed local capacity was in place to use those resources. So greater recognition about the level of readiness in communities and the support folks need to use data, right? Data doesn't do the work, but it's essential, right, to answer the question for whom and to what end. So the analysis of the data and the capacity, certainly flexibility in how those funds are used. We saw this with the opioids epidemic before COVID, and now post-COVID, many of those things are worse because of fentanyl. Overdose deaths are up, and a lot of these funding mechanisms just don't allow to really meet the needs on the ground and what people are seeing, right? So some greater flexibility, and recognizing level of readiness does differ, right? So sometimes the capacity is in place and sometimes it isn't. It's not one size fits all. So our whole Cities of Opportunity initiative is structured to meet cities where they're at. There's where we want folks to be, and then the reality of where it is. And some of this has to be tailored, right, accordingly. And so, I think I would just say, I also want to say governmental and private funders have a role, right? There has to be some greater intentionality toward alignment of funds. And so, what one can do, another could augment, right? And there could be some better coordination. And so those are some of my high level thoughts.
Great. Amy, I'm going to ask you a last question, and then Dr. Ford, I want to end with you. But Amy, you are a statewide organization with lots of different stakeholders involved, but is there an ask of the federal government?
So this would be my ask of the federal government and really any funder, and that is that we rethink the idea around administrative expenses or administrative caps. If we're asking for data analysis, if we're asking for different types of tracking, research, now thinking about how most of my staff doesn't work in an office that I pay rent for, it's spread out in their homes, but it's a technology capacity that is above and beyond what rent would have cost me. All of these things are considered administrative expenses and very hard to even fit into the definition of cost of doing business. They're truly what would have been considered indirect cost. And so indirect allocation plans have been blown out of the water, and it's a whole new world of thinking about what goes in. If we want these results, then we have to pay for them one way or another. And and the government kind of sets the lead on oftentimes also how philanthropy thinks about those. And so this is really where we need to set a tone and where we need to show that there's a value in these levels of information and capacity being built within the system.
Thanks, Amy. So Dr. Ford, we've gotten a taste of what your daily life is like, hearing from stakeholders on all the things that they want the federal government to do. And you have a hard job because you have to take external input while also working with your internal colleagues. And I thought a great ending to this might be some advice from you to your, the 50% of people on this call that are public health, or even people who are in non-healthcare fields. How do you approach somebody that's not in your vector, and say, and like tell them how this is valuable to them? So how would you, like, how does HUD or AG or ED or, any of the alphabet soup of agencies within HHS, like how do you kind of make your pitch about why they should come to the table and want to integrate some of these programs together?
And that's a great question. That's the big challenge, is trying to get that understanding that this really is connection. It's everybody's issue. And I think that, everybody kind of elbows HHS whenever I start talking. It's like, no, I'm talking to you. We need to make folks understand that the health certainly is an important component of this. That's clear, but the other pieces of it are the reason we are not successful. I think we've gotten plenty of health-related programming and we still have terrible outcomes. And so we need to start looking at some of the other agencies. And in this position and in my previous life as a public health director, basically people would ask me what I do for a living, and I tell stories. My job is to tell you a story that is so compelling that you're going to want to help me. And that's really all I've been doing for the last year and a half, is just talking and talking and talking and trying to help people understand the connections and the link of, if A, then B, because, we have, generations of unhoused. These isn't just individual folks. These are folks that are just grandparent level, and so we wring our hands and what are we going to do about it? But we keep doing things in silos, and that has not. Being a newbie in the White House, when I first started to try to pull this group together, everyone was like, who is she? We don't know her. What's she trying to do? And slowly we started pulling people in. And now it's kind of like the hot ticket on Wednesday. I literally get people like, hey, can I get an invite to your thing? And I'm like, it's wide open, because we need to have as many non-health people there as possible, because A, they think differently, and B, they have a different set of resources. And so, we have to be as inclusive as possible in the solution piece of this, including the finances, who also don't always want to hear about this stuff. But we've got to continuously talk about this ROI. When you keep people out of the hospital for whatever reason, ultimately everybody wins. And so that's really what in a nutshell we're trying to do here, is explain the win. The win of this is that you have a healthier population, which benefits us all in so many ways, from productivity on down. And so trying to help these non-clinical or health-related agencies understand not only should they have a role, they must. It's an obligation. If you really consider your program to be effective, you have to be partnering with a health-related agency, because we know what the needs are and you have what we need. So that's about the shortest nutshell I could say. But it's all about partnerships and collaborations and relationships and clarity of mission.
Yep. And as you were talking, I was thinking probably, everyone on this panel and many of our participants have had that same experience. When you're trying to bring disparate people together, they're going to say, I don't know you. Are you coming to take my money from my program? There's a lot of defensiveness right up front, because a lot of people, it is their job to manage this program. And if you want to,
Right.
you know, integrate this program a little bit with this or that, it can be threatening to people. So
Yeah.
leadership, relationships, reaching out, and this brings us full circle to the beginning of our webinar, where we talked about how important it is to collaborate across sectors. So I know we've got a lot of people on this webinar that know this and already do it, but encourage others in your community to just take that small step of starting to build relationships, because again, we can look at this problem as so big and so difficult, but you know, the minute you start talking to people and finding ways that you could work together, it starts to break it down piece by piece. So I hope everyone feels inspired to go out and coordinate, because look at the amazing things that this whole panel is doing. So really appreciate you being here today. And Amy, I know you had to leave your big event, your big in-person event, to be here. So thank you. And Sue, we look forward to following all the great things that you're doing, and we want to post that stuff on your website. Erica, if you have stuff that you want to disseminate, you have learned so much over the years. And of course, Sandy, when you have your big report, we want to help make sure that everyone gets it and
Oh,
sees
absolutely.
it. And to our audience,
You know,
if you have, go ahead, sorry.
I'm sorry. You know, the other thing about this, when we first started approaching agencies, everybody was saying, we're already doing something, you know, and
good.
I thought I was already doing something. No, I thought I was already doing something when I was practicing pediatrics, because I was taking care of this kid, but I wasn't taking care of this kid. Do you know what I mean? And so when we say we're already doing something, be humble enough to recognize that whatever you're doing still can be improved upon with some more collaboration. So I always say that, because you're right. There's also a defensiveness of you're attacking my program, my work, and it's like, no, but everything is better when more hands are involved. So that's yeah. Sorry.
And so if you have particular things that you want the federal government to give you, to tell you if you have permission to do, please let us know, because sometimes the folks that don't want to integrate or coordinate use, the federal government as kind of a crutch to say, oh, they won't let us do that. And it can hinder very well-intentioned collaboration. So I would love to take Dr. Ford up on her offer to, to help us get some clarity on what's permissible. So anyway, thank you very much. We're at the hour. Appreciate your participation. Take care.